Welcome to Appointed.
Well, we're here for another episode of Appointed, the podcast that was developed by the amazing team of particularly interns, folks who work in our office, and young people trying to drag me into this century of social media. And I'm very, very pleased to be joined today by Kendal David, who is joining us. I think you're here on the territory, the unceded, unsurrendered territory of the Algonquin-Anishinaabe as well, although you're originally, I understand, from Treaty 7 territory. And you're in addition to being a PhD student who's in the, thank you, has taken time in the middle of your final throes of this amazing adventure to speak with us, but you're also someone who has been leadership in the Basic Income Canada Youth Network, which is a group that has really been leading the way in terms of the type of work that we're trying to do as well, the guaranteed livable income. So I'd like you to also introduce yourself and how you became interested in this whole area, Kendal, and if what you're working on for your PhD is, I think, extremely relevant as well. So over to you.
Sure. Thank you so much for having me, Kim. This is very exciting. I am a very big fan of podcasts, listen to a lot of podcasts. So it's I'm glad that you have this project, and it's very cool to be here with you. So I am here in Ottawa right now. I'm doing my PhD at Carleton in the School of Social Work. And as you said, the co-chair of the Basic Income Canada Youth Network, which is a mouthful. My interest in basic income really started when I was finishing up my undergrad in social work back in Calgary. And I was doing practicum placements with the United Way and with the City of Calgary. And at the time, they were revamping their municipal poverty reduction strategies. And so I was getting to hear a lot about the work that was happening to address poverty at a municipal level, which is really important. But was also became disillusioned quite quickly and frustrated quite quickly about the resources that were spent talking about poverty and talking around poverty, and the lack of steps forward to actually address the consequences of poverty, or address the root causes and make sure that people have cash today. So at the time, I think we were just they were just coming to the end of their 10-year plan to end homelessness as well, and there had not been substantial shifts in homelessness at the time, and so I was really kind of feeling frustrated and not sure what to do. And there had been some local basic income advocacy in Calgary I got involved with, which is really cool, really exciting. And I noticed pretty quickly that most of the people who are involved in basic income advocacy are in Canada are retirees and folks who are coming from long careers in the social services sector and academia, who wanted to focus their advocacy efforts on anti-poverty efforts, but who had a lot of time on their hands and were structuring their advocacy in a way that sometimes made it hard for young people to engage. So had a good experience with Basic Income Calgary, and they connected me with other young people across the country who were thinking about basic income. There were relatively few of us that had been identified through kind of the existing channels, and we started meeting, and eventually formed into the youth network, and we're a lot more of a kind of solidified formal group now than we were then, but that was my entryway in. And my academic work has really been interested in disability justice and disability issues, actually. And I came to social work after already having done work in the disability service sector, but also having been involved with disability community and in social and rec programming specifically for disabled people, and So I came into social work really interested in disability issues, and then was also frustrated and felt kind of strange when I came into social work and realized that there's not as much discussion and emphasis on disability as I was expecting there to be. And so my past research and academic work has looked at kind of the overlap of disability and social work, but my PhD research is kind of blending that interest with income supports. So I'm currently thinking about studying the ways that disability is made to be a very real category that shapes policy, and in particular how that works in income supports, how that shapes income supports, or ideas of who fits into the category of disabled and who doesn't. And so there's a few different threads there, but the income support and basic income work has really shaped my interest in the PhD at this stage, but still bringing that disability lens for sure to the fore. Mm-hmm.
Well, that's fantastic, and I can hardly wait to not only read but add your PhD thesis to our annotated bibliography, which another one of the fabulous folks working with us this summer is updating at the moment. And as you were speaking, it made me think. I want to talk in a bit about Bill C-22 and the disability benefit, and how we see that as another incremental step towards a guaranteed livable income for this time with folks with disabilities. But the ways in which the definition is important, but also the amounts and the qualifications become important, because as you probably know, in this province, in Ontario, the majority of people who apply for what's called ODSP here, the Ontario Disabilities Support Program, if I got it right, usually are denied initially, have to go through the appeal process, and the majority then are accepted on appeal, because the appeal division looks at, do you really have a disability? And yes, and proceed. And it probably wasn't lost on you or me or many of us that just was it last year or the year before, the current government talked about getting rid of the appeal process as a cost-saving measure, which horrified many of us. And so I'm interested in two main things, more than two main things, but two things to launch the next part of our discussion today, which is, there are many misconceptions about what a basic income is. And, just this morning, we were having a discussion about the fact that we have to do some myth busting. Virtually everybody thinks it will create a community of layabouts, for lack of a better term, that a basic income is a disincentive to work, without any exploration of the ways in which current support, so-called welfare or social assistance schemes are actually the disincentives to work. And your network did a fantastic job of dispelling a lot of the myths and stereotypes, particularly focusing on what happened when the Ontario pilot existed and what people actually spent their money on, as well as how many people got ahead, became entrepreneurs, were able to get training, were able to take care of folks who needed care, all of that. So, what's your sense of the biggest stumbling blocks that we're still facing, when we talk about how do we actually implement a guaranteed livable or basic income?
Mm-hmm. Yeah, there are many, I think, stumbling blocks, a lot of misconceptions, a lot of challenges in this work. And I think even just our kind of conversations about what basic income could be and what basic income should be really, I think, push us to consider and reflect on some deeply held beliefs that we have and that are ingrained in policy about the value of one's life and good ways to spend our time, good ways to spend our lives, the right ways that we should be making contributions to the world, really kind of narrow definitions of what work is and what kind of worthy, dignified life is. And so I think there are a lot of misconceptions and a lot of challenges. And I think it means that talking about the details of basic income and the possibilities of basic income are really important, kind of put those issues on the table for us to be reflecting and thinking about what what some of those beliefs are. And so, yeah, I mean, of course, I don't think I've ever done like a speaking engagement about basic income where I don't get questions about work and about labor. And every conversation I have, over coffee at a bar with friends about basic income, this comes up all the time. And, I think that in the last couple of years, the advocates in the Canadian movement have done a really good job of putting forward the evidence that we have from pilots, basic income pilots, around what we know from how people change their relationships to work when they receive a basic income. And I think that talking more about the current system that we have in place and the ways that it is, like you said, our welfare systems already trap people into these really tricky predicaments about like balancing the number of hours that they're working with how much they're earning and what they have to report to their caseworkers in order to be still eligible for benefits. I think that's a really important part of the discussion to bring up too. It's we both, the other co-chair of the ICYN, Chloe Halpenny, and I have worked on research projects from the Ontario pilot, and heard so much about how degrading and paternalistic the ongoing experiences with caseworkers are. The surveillance of people's bank accounts, having to report money that they earn from panhandling and bottle returns to caseworkers to determine how much money they're eligible for the next month. The work that is required to maintain your status as the right kind of disabled person to stay on ODSP or AISH in Alberta, like all of the work that people have to do to justify their prove their deservingness of supports through the current systems that we have, and all of the ways that makes it really hard for people to get employed if they want to get employed. The time that takes away from people spending time applying for jobs or upskilling or spending time taking care of family members. Like the work that goes into staying on welfare is enormous. And I think talking about how flawed the existing system of income supports is in Canada across the provinces and territories is a really important part of challenging what we are hearing about work when we talk about basic income too. And I think even further to that, something that I bring with me from the disability work that I do and the disability kind of community engagement that I've been involved in is also pushing us to think again about what makes a life worth living and why people's potential separation from the formal labor market feels so scary to us, and what that says about how we value our time and what it means to live a good life. So, I know a lot of people who will probably never work in their lifetime at all, who will never be formally employed. And there is no part of me that thinks that they don't also deserve to have food on the table and live a good life. And also no part of me that thinks that they are not making contributions to their communities, to their families, to the world at large, even if they never get a T4 in the right, like they've never earning a paycheck. And so I think that continuing to talk about and actually seriously engage with people's concerns about labor and people's work engagement is really important part of basic income discussions. Yeah.
Well, and I'm curious as to what the discussions are these days. When I've presented to social work students, one of the things that's been surprising to me is how many social workers end up employed in policing people's income, behavior in ways that is not what they went, for the most part, to school to do. They went because they were planning to do supportive work and assist people and not police people's incomes, morality, and the like. And so I'm curious as to how those, if you have some of those discussions with your classmates, or I guess in the past it would have been more your classmates. Now you're on the path to your PhD, so yeah. You still have classes, or you maybe finished all your classes, but I'm curious as to how those discussions go and what they think of the idea of basic income, or if those discussions come up.
Yeah. Yeah, they definitely do come up. I have been very fortunate to be teaching assistant in a political economy of welfare class at Carleton the last couple of years, which is a required course for social work students. And so we talk about income supports quite explicitly for a couple of weeks, and talk about basic income one day. And so that's kind of my touchstone of getting to talk to social work students, and a lot of social work students are even coming into programs with experience working already in welfare systems or doing personal support work. And I think people, I hear a lot of students who come back to school to get the BSW, to have the letters behind their names so that they can, have a little bit of institutional legitimacy to challenge the things that they're seeing in their practice. And I think that there are certainly social work students who are really interested and keen in basic income and thinking about new ways to deliver services to people that are more just and more equitable and more fair, and that mean that they're doing less of the kind of state policing surveillance work that any of them are doing right now. But I think, it's also a mixed bag. We know from research with welfare administrators that there are also folks who work to deliver services and see some of the challenges that people are facing and see some of the responses that people have, just trying to get by and make it through in really unjust systems, and view people's needs as requiring more control and more like that the response should be better regulations and more policing and more surveillance. And so and view the role of social workers as being the best people to do that monitoring and do that kind of controlling work. And so it is kind of a mixed bag, but I think the undergrad social work students that I'm meeting in the last couple of years tend to be really keen about basic income. I think for a lot of the same reasons that I was and continue to be, view it as an alternative to the systems that we have now, and a way of thinking not just about all of the terrible, awful, sucky parts of our existing welfare system, but as kind of a stepping stone to, real concrete stepping stone to more just income support systems.
Yeah. Oh, fantastic. And we've already talked a bit about the fact that the Disability Benefit Bill C-22 passed just as we finished the session and before we rose for the summer. And when I say we, the House of Commons and the Senate of Canada. And, you've advocated for substantive equality for years and continue to do that. And some people, including me, have talked about C-22 or the disability benefit as another incremental step from the Canada Child Benefit, the guarantee for children or children living with parents living in poverty, guaranteed income supplement for seniors living in poverty. Now we have the disability benefit, which depending on how much it is, depending upon clawbacks and all of those issues, may be the next incremental step. What do you think is holding us back from taking the next step to provide this for everybody? And what are your critiques of the C-22 as well?
Yeah. It's such an interesting kind of site of friction and tension for me. And I think for all of the members of our steering committee at the Youth Network, because, disability issues are very near and dear to many of us in the network. And we really, see and feel the urgency of addressing disability poverty and the realities of very honestly horrifying choices that people are faced with right now, about the realities of being a disabled person and living in poverty in Canada. And so it's an interesting kind of site of tension, because we hear, we see the the text on the bill that says that the goal is to address disability poverty, that it is, you know, about making sure that people have what they need to be well and live good lives. And, you know, I don't know how that I felt very excited when the bill passed, you know, whenever it was 2 weeks ago, because it was so bare and didn't really feel like kind of the substantial commitment that that we would like to see. I don't actually feel super clear like where we go from here. And I have ideas, I have suggestions, I have recommendations, but it feels like, you know, without the pieces of, you know, defining eligibility, without knowing how much the benefit is, without knowing what the clawback protections are going to be, without knowing all of these bits and pieces, you know, the anxious part of me, but also the part of me that recognizes that this is an issue that hasn't been addressed and has been failed to be addressed for so long. The government has not been capable of addressing this issue to date. It's like, maybe we're going to get basically the GST credit where people are getting $80 every quarter or whatever it happens to be. And for somebody who's making a decision between you know, a meal that day and being able to pay their rent on time, being able to afford the necessary medications they need to live, between being able to purchase clean needles that they need for administering medications, like $80 every 4 months doesn't cut it. It's just not enough, right? And worry about all of the people that are going to be excluded inherently because we don't know what those definitions are. And so I think I do think that it can be kind of a form of basic income, an incremental step in the way that the child benefit and the guaranteed income supplement are. But I think where the difference really comes in for me is how we're defining who's going to be included. Because, you know, in an interview with Globe and Mail, I think 2 weeks ago, Minister Qualtrough said, you know, part of the delay is that the federal government doesn't have a list of people with disabilities that, you know, we know where to send the checks and how much they should earn. And we don't have that list of people in the same way that we did with seniors, in the same way that we did with children and families with children. And you know, there are, of course, definition and eligibility tricky things that come with age targeted programs as well. But I think I might feel more confident and more excited about the benefit as a step towards a basic income if I had confidence that the federal government could make that list in an inclusive way. And the existing exclusions of disabled people from federal disability data makes me really anxious about how we're going to pull a list together that feels inclusive. You know, people who are living in congregate settings have been excluded from federal disability data for decades, right? We don't know where disabled people are living. If they're living in group homes, we don't know where they're living, if they're living in hospital settings, if they're living in psych wards, if they're, you know, in long-term care, the young people who are living in long-term care. If the federal government has because of the exclusions of congregate settings in our data, like we have these massive gaps of the poorest of the poor disabled people. And we know that social assistance benefits and the provincial mechanisms for disability data gathering are also inadequate and also leaving people out, right? And so I think that if C22, if the framework is going to be developed in a good way where it casts a really wide net, it reaches as many disabled people as possible with as few restrictions on eligibility criteria, and, you know, really minimal monitoring and surveillance is a part of the criteria, and as few clawbacks as possible, I will be excited and view that as a step towards a more robust income support system. But I'm really, I want to be hopeful, and there is more advocacy to be done. And I think there's just still a lot of work to do.
Mhm. And given your activism, your leadership, and your academic expertise in this area, has anybody from the government reached out? Have you had discussions with the disability community that is being consulted about how to address all of those issues? Because certainly the government is aware that the poorest people who might be eligible for all kinds of benefits now, even before we get to the disability benefit, don't get those benefits because they don't file tax returns. So in the last budget, they were talking about automatic tax filing and implementing something so that people who are eligible for benefits could actually access them. And it sounds like you have not been consulted, but it sounds like something that the government should be looking at is folks like you who are leading in this area and have the research, the most current research of, certainly more than those of us who are, looking at the legislation after it comes through and trying to fix it after the fact, than we have available to us.
Yeah, I think, I worked on a project 2 years ago with a colleague of mine at Carleton, Megan Linton, on a project called Invisible Institutions that, came from her master's thesis work looking at the ongoing institutionalization of disabled people and the way that takes its shape in Canada now. Because I think we sometimes gloss over the ways that that people are still facing really tough choices and are not enabled to live in community in good ways. And anyways, as part of that project, we were looking at federal exclusions from disability data, but and had some conversations with StatsCan at the time. But also, big learning from that project for me was around like institutional allowances and the ways that people who are, for example, poor people who have disabilities who are living in long-term care, because that's the only option for them where they're able to get access to the medical care that they need outside of a hospital setting, because they don't have the provinces don't have adequate home care supports for folks. The allowances that they are afforded through social assistance are so much lower than the rates of social assistance that people who are living in community have access to, which are inadequate, right? But we're talking about $80 to $300 a month kind of thing, depending on the province, and that's supposed to cover your transportation costs and any food that you want to purchase that's not the mass-produced food that you get on a tray in long-term care. It's supposed to cover additional supplements and medications, your phone bill. People don't have access to Wi-Fi and internet services, like all of the things that that people need to kind of live a good life. And so I think that there are lots of, because the supports that are available to disabled people are split across provincial and federal jurisdictions, and there are all of these, again, like eligibility criteria and restrictions in different avenues. I think there's a lot of gaps, and doing some, it will be very important for the federal government to do good consultation with a wide variety of people to make sure that disabled people get disabled people get the benefits that they are entitled to. Yeah.
So what do you see as some of the steps forward of how we could do this work? There are many of us interested in this, and there's a huge movement in this country. As you know, you're part of one organization doing it. You're also part of the Basic Income Network writ large, and there are many of us trying to work. What do you see as the ways that we could be working together to actually make this happen now? That it feels sometimes like, well, it felt during the pandemic like we were on the cusp, and then and that there might have been an opportunity to pivot from CERB to, a basic income. It didn't happen. What do you see next? How do you see us moving forward on this? And what are some exciting developments that you know of that might actually encourage more people to become involved? And just before you launched that, I want to say that as you were talking, I was reminded, we many times forget that, and during the medical assistance in dying debates, much was made of the living conditions that you just spoke about. And I was struck, I was meeting with a friend who I went to law school with, actually, who had a stroke in her early 50s, was practicing law, was doing well, but suddenly had a stroke, was immobilized. She lived on her own, so she wasn't found right away. So the impact of the stroke was more profound. And then because she lived on her own, the doctors would not release her back home because she was falling and was not fully mobile. And she ended up in a home with most of the people were in their 70s, 80s, 90s. And as she said, as she's dealing with aphasia and trying to just work through and get back speech, mobility, she's in a context where everything about that was discouraged. She was encouraged just to sit, plant herself in front of a TV, and really discouraged from thinking that she could ever have a meaningful life. And how devastating that was to someone who, was very active in the community, very, a practicing lawyer, and people would describe her as someone, or some people would describe her as someone who, maybe isn't deserving of more benefits than she got. Yet she'd worked most of her adult life by then after law school, and yet her insurance didn't cover more than what she received. And as we know, it gets clawed back, and so she was living really a subsistence life. And I worried and we talked about the fact that medical assistance in dying looked like an option. And the number of people who have been weighing these quote unquote options when really they haven't been provided what I think of as substantive equality, the right to live a meaningful life. And we're first providing, we're making more available potentially access to death than we are access to life for too many people. How do you see us moving forward? Do you think, do you think the Canadian public will rise up? Where we've long prided ourselves as being human rights protectors, and internationally, and here in our own country. What do you see as the future, and what are the things we need to be careful about, and what are the potential positive things we could be working on?
Okay, so I think that these are really big questions and important questions to be asking, and having the conversations around the expansion of MAID in Canada alongside the conversations we're having about poverty and income supports and dignified income supports is so important. I think the connection is so clear to me, right? And I think that when we know the history of institutionalization, the history of eugenics, history of like selective abortion and prenatal screening, and the really important disability history in Canada, we can see just how it's not neutral or random that we are having discussions about the expansion of MAID for disabled people at this particular moment in time in history, right? That it's not a coincidence that people are facing just impossible, heart-wrenching, quote unquote choices about how to move forward with their lives or not. And I think that the piece about real choice that you mentioned is so important, right? I don't know for people who are not tuned into or engaged with like disability communities, or with a lot of disabled people. Like, I don't know that people realize just how significant the like reality of poverty is if you become injured or ill and are not able to work, right? Like, just how few supports there are if you are not able to, especially, and to do meaningful full-time work. And people are already working and don't have the protections that they need, the benefits that they need, even for people who are employed and are able to earn a living that way. Like, if you lose your earning capacity, the options are really grim. that I don't want to live. I don't want to live in a community where that's the reality of it, right? I think it's just not okay. And people who are considering medical assistance in dying, or people who are thinking about it and trying to make decisions about how to live their life in a good way. We haven't done a good enough job to give people the options that they deserve to live a good life when you're injured, when you're ill, when you can't work. It's just not enough. And so I think that knowing that over history, eugenics and physician-assisted suicide have been cloaked in really progressive language and really progressive aims and ideals about a good society is important for people to know, to have that historical context and understanding this current political moment and the decisions that we're making around MAID. And I also think, that in terms of basic income advocacy, while the maybe initial excitement of emergency benefits and what that could mean for basic income has waned in the last 2 years, I do also think that the basic income movement in Canada is in a much better place than it was 3 years ago. The infrastructure, the connections, the coalitions that have been built are really impressive, right? We have, a youth network now. We are engaged with young people who are interested in talking about poverty and talking about how to make better systems and better supports. And so I think that, while the kind of public discussions about basic income may be shifting and not quite as in your face as they were when CERB was being rolled out and when emergency benefits were available, I do think that the kind of background work that's happening in terms of anti-poverty organizing and basic income organizing specifically is just light years ahead of where it was when I kind of first stepped into this world more than 3 years ago now. So I think that continuing to have, basic income, the folks who are involved in basic income organizing, continuing to have discussions with other organizers and viewing the issues of disabled people, for example, as relevant to our conversations and our thinking about basic income and vice versa is really important. Continuing to establish connections with other people who have been doing the work to advance substantive equality for a long time is really important. And I think it's a little bit cheesy, but we say that at the Youth Network, we talk about basic income as a glimmer of hope amidst contexts of real political uncertainty that many of us under the age of 35 have grown up with. And I do really think that I do actually really feel that way, that thinking about what we can build, what is possible, what better systems are available, how we can, what the underlying values are of how we show up for one another, how our communities can and should be structured in ways that don't require people to be in full-time work to live a good life, having those conversations and not just thinking about all of the things that are wrong and bad and scary right now, but what we can do to build a better world, to build better communities together, I think is really important and very hard, but really important work to move forward with.
Right. And I would be remiss, and my team would likely tell me the same, and so would Leah Gazans, if I didn't ask you what you think of the work we're trying to do to get a national framework. Do you think that's, should we be instead pushing something else? I mean, we're trying to do something that we were able to do at the federal level, but what do you see as possibilities there, if any?
Yeah, I mean, BICYN and has endorsed both of the bills and has been involved in trying to help move those forward and keep the conversations alive about them. I think that they're really important, right? And the bill in the Senate has sparked conversation and has meant that we get to hear what senators are thinking about poverty and what they're thinking about income supports and what their visions are for more just systems, or what their concerns are about basic income. And so, you know, again, I think all of those conversations are really important, and confronting the very real issues and concerns about design and concerns about adequacy and fairness are, you know, having those conversations is so important. And it means that when the time comes for basic income to be implemented, we're not going to be fresh to it, right? We're not going to be trying to throw something together. We're going to have ideas about what is really important and matters to us. And yeah, I mean, I think that I'm a very firm believer that there's not one right or one most important way to advance social justice and to make social change happen, that we need a diversity of approaches. We need lots of different people who have different ideas and different skills and different institutional power, and who are working in different contexts to move issues forward and to make real change. And so I think that I most certainly see your work in the Senate and Leah Gazan's work in the House as really integral components of kind of the broader fabric of moving basic income forward.
Well, I think we all hope that all of your voices will be there to actually make it even better, because we're, you know, everything's moving in a pace that for many of us, certainly me, as we get to a certain age, we're so grateful that your youth network and so many other much younger than us folks are leading the way, because we see it as a hope for, quite frankly, generations to come, and really, really vital for this country, but also the world. So I want to thank you very much for your work, your advocacy, your leadership, and the ways in which you will continue to shine a light and help us focus on moving forward in the best way possible. So thank you very much for joining us, and keep up the great work. All the best with your exams and your papers, and yeah, get that thesis out so we can spread it far and wide.
Awesome. Thank you so much for having me. This is a real pleasure and an honor to chat with you today.
The honor is mine. Thank you. Take good care.